Welcome back to the Perfectly Holistic Podcast. How is everybody? My name is Pam. I'm with Perfectly Holistic, and I am super excited to be live with you tonight. Yes, it is a live presentation. We are streaming on Instagram, our favorite YouTube platform, and Facebook tonight. So if you guys are watching from any of those areas, definitely drop a comment in here. Let me know you're here. Let me know where you're watching from. And I'd love to say hi to you guys individually if possible. So we are going to talk about parasites tonight. And I know it's not probably your favorite topic, but I've had a lot of requests for a discussion and learning more about parasites in cats and how to treat those. And do we deworm automatically? You know, there's a lot of parameters we can look at when it comes to parasites and deworming, and how often, and is it needed, and what should you do? There's a lot of questions out there, and it's not necessarily really cut and dry. So there's a lot of gray areas, and we're going to kind of go into some of that tonight. So that's what we're going to be talking about. And I've also created this really cool graphic, thanks to AI help, that shows you the most common types of parasites. We're going to talk about internal parasites. Let me clarify. So it's internal parasites that we're going to discuss, not external. But the internal kind, and we're going to talk about several of the most common kinds. And in fact, some of my clients have had several of these. So it has a little bit of an ick factor, but I think you guys are, well, let me say this. Our audience here is always about learning, and you guys have always posed some really good questions, and you've asked about some really good topics. So this is going to be one of those topics I hope you get a lot out of. And feel free to drop some questions over here in the comments as well. I can't see your comments on Instagram, but if you want to drop a comment, you can come over to our YouTube or Facebook platform and just find our stream. It's live, so it shouldn't be too hard. And then just drop a comment below the video, because I can see those pop up on the screen. So let's dive in, shall we? This is going to be really cool, and I'm going to pull up some information real quick. Okay, so to the topic again, beyond routine deworming, what wellness vets recommend for cats. And I put it wellness because there's like integrative, holistic, proactive wellness. It's kind of all under that framework, because I specifically wanted to look at what specific vets, and I named some vets in my search, like what they're talking about and what they've recommended and their thoughts on the subject and that sort of thing. So that's kind of where we're going to go with that discussion. Let me pull something down real quick. Let me see if I can move something around so I can get back to my screen. Okay, let me fix this real quick. Okay, so first of all, I'm curious, for any of you guys watching tonight, have your cats had or been tested for internal parasites, and what were they, and what did you end up doing? Because that's always very interesting to me. Years and years and years ago, when I was not in the holistic space and just doing the routine thing, I know that it's very common for vets just to automatically deworm a kitten, deworm a cat, you know, if they go outside, sometimes even if they don't go outside. And I didn't ever give it much thought, but now that I'm in this integrative holistic space, I give everything a little thought, right? And I ask a lot of questions. I ask the question, why, all the time. I'm sure I probably did that to my mother when I was growing up. It probably drove her crazy. But I'm that child. I'm like, but why does this happen? I want to understand the why behind stuff. Okay, so I want to say a quick shout out to Atina Martin, hi, and Simon, Sweet Pea, and Jack all say hi too. Give them lots of love for me. That's awesome. I hope they're doing great. Okay, so let me go back over here to my outline. Hang on one second. I have a little outline I'm kind of sticking to so I don't lose my spot here. Okay, so what we're going to talk about is more of a balanced educational discussion around internal parasites in cats, strategic versus routine deworming, fecal testing, gut health, very important, raw feeding considerations, and holistic and integrative veterinary perspectives. I don't want you guys to be fearful about parasites because let me tell you, the absolute truth is we all have them. And in a healthy body, the immune system, and the gut can manage this symbiotic relationship because we all have some level of parasites in our bodies, and our pets do too. It's when things get a little out of balance that things can cause problems, and you have icky problems. Poop problems and gastrointestinal issues and vomiting and things like that. So it's just a fact of life. And in this day and age, it's all about education. It's knowing what's out there, knowing your options so that you can make informed educational decisions. And the other thing that I wanted to make sure I say is I am not trying, this podcast is really for educational purposes, and it's not veterinary medical advice on any level. So if you are thinking that your cat may have a parasite or a parasite problem, do definitely consult your vet and consider the things that we're talking about tonight, because I think it will help you make more educated, informed decisions about the kind of care that you choose. Okay, so for decades, routine deworming has been considered standard pet care. But today, many proactive wellness and integrative veterinarians are encouraging more individualized conversation around parasites. So gut health, long-term wellness, and that sort of thing. So we're going to cover the most common internal parasites in cats, and I'm going to show you what they look like. I'm going to talk about how cats can become infected, the conventional veterinary recommendations, what wellness vets focus on and recommend. We're going to look at fecal testing versus automatic deworming, raw feeding and parasite concerns, the controversy, and finally the controversy around parasite cleanses, or in other words, what to do about them. Okay, so let's talk. I'm going to show you a graph, and give me a second because I'm going to share my screen, and I'm going to show you what these really interesting parasites look like. Let me see if I can. Let's go with, no, not a Chrome tab. Hang on a second. Okay, let's see if this works. Okay, I'm going to come over here. I want to see if you guys can see what I am going to present. Let me see if this works. Hang on a second. Share the screen. It's not a Chrome, it's a window. Hang on, sorry guys. Entire screen. Or, no. Oh, now it doesn't want to share my screen. Well, let me see if I can work this another way. I'm not going to restart Chrome. My goodness. Okay. Let me see if I can load something. Sorry guys, bear with me just a second. It shouldn't be this hard. Well, shoot. Okay, well, it may not. Don't you just love technology? It never works when you need it to work. What I'll do is I'll figure out how to put this maybe in a Google Drive that you can click on when you're watching this, to so you can see the most common internal parasites in cats, and you can see what they look like and all this stuff. But what I'm going to do is I'm going to go over them kind of just a quick general overview. One of the most common ones is roundworms. They're like the most common intestinal parasites in cats, especially kittens. And they're long and squirrely, like just, they're long and skinny and look just like a little earthworm kind of, but super tiny. Okay, so common signs that your cat may have roundworms would be a pot belly type of appearance, especially in kittens. There's vomiting, there's diarrhea, there's poor coat, there's weight loss, and the worms can be visible in the stool or the vomit. I know it's gross. They can be passed from the mom to the kittens. They can ingest eggs from contaminated soil and feces or environment. They can also get it from eating infected prey. So that's the first one. The second one is hookworms. And those look like a little earthworm with a little sucker at the end. They're smaller, but they're more dangerous than roundworms, especially for kittens. They can contribute to symptoms like anemia and weakness, pale gums, dark, tarry, or bloody stools, weight loss, and poor growth, especially in kittens. They're ingested. How they get it is they ingest the larvae from the soil or a contaminated environment, and larvae can penetrate the skin, which is a little bit less common. This can be kind of common if you work around farm animals, so that type of soil environment. So that is a very common internal parasite for cats. The third one that you've probably heard of are tapeworms. And tapeworms look like little segments of rice. When they're all together, it looks like a little choo-choo train with just all these little segments connected together. But when they show up in your cat's poop or on their butt, it's like one little grain of rice. That's what it can look like. There are rice-like segments around the anus or in the stool. They're butt scooting a lot on the floor. So sometimes when you see your cat do that, that may be why, because it itches. It itches around the tail area. So that's why they do a little butt scoot. Your cat may have mild diarrhea, and it could have weight loss if there's if it's a serious case, okay? They ingest, how they get these little worms, these tapeworms, they can be ingested from infected intermediate hosts like rodents or other wildlife that may have these parasites. Probably more common in cats that can go outdoors and have access to that kind of prey. Another type are whipworms, and they're less common, but they can cause chronic GI upset. So common signs or symptoms would be a chronic or intermittent diarrhea, blood or mucus in the stool, weight loss, dehydration, and your cat gets it from ingesting eggs from contaminated soil, feces, or litter boxes. So they look very similar to roundworms. So, if I guess you probably want to have a person who really knows what they're looking for. Like, go to your vet. If they're going to take a picture under the microscope and they can tell these worms apart. And I think it'd be interesting if they showed you what they see in their slides. Another common one, probably more common than you would probably realize, is Giardia and other protozoa like oh God, I can't even pronounce that word. I'm not even going to try to pronounce it, but Giardia and other protozoas. These are like amoebas. These are not worms per se, but they're microscopic parasites that affect the intestines. Common signs are diarrhea, mucus and stool, gas and bloating, dehydration, poor coat, and weight loss. And let me tell you, the smell of diarrhea is off the charts. One of my cats had this as a kitten, and it went undiagnosed for a while because they were trying to treat, other stuff, and it wasn't regular worms. It was the Giardia, and it's awful. It's awful. I will tell you, it smells, it's, oh my gosh, the smell, you never forget that smell. Um, how they can get it is ingesting the cyst or the oocyst from contaminated water, food, soil, or litter boxes. And it's common in multi-cat homes and shelters. It's easy to pass around. So you talk about some deep cleaning when your cat gets a giardia. It's a serious. It's an undertaking of a serious project because it's a you have to do so much cleaning and throwing out litter and replacing litter. It's so contagious. Um, so that's the Giardia and protozoa. Remember, those are not worms, but they're microscopic, like amoebas. Um, and then the last one that I've had clients actually have this before are lungworms, and they kind of look like roundworms. They're parasites that live in the lungs and the airways. So common signs might be coughing, difficulty breathing, wheezing, lethargy, vomiting, and weight loss. And sometimes they actually vomit up the worms, and that's why they discover them because they're cough, 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 and all of a sudden there's worms coming up. Totally nasty, yes. How do cats get it? They ingest infected snails, slugs, or prey, such as rodents, birds that catch the larvae. In my client's case, I remember her cat was chasing and eating lizards. Gross. But it got the lungworm from the lizard. It was, yeah, disgusting. Um, so, yeah, that's not fun. But those are 6 of the most common types of internal parasites that we will talk about in terms of parasite stuff tonight. So, going back to your question, have your cats ever had any of those parasites before? And I'm curious to know what you did, how you got rid of them. Are you going through it right now? I know I have a client right now that it's actually her dog is actually struggling with this, with the Giardia stuff. And in some areas of the country, it's more common than others, and so some pets have a greater chance of continuing to be exposed to it. So it's just one of those things, right? We just have to stay on it. Okay, so we've talked about the 6 types of parasites, internal parasites. So let's talk about, let me scroll down 1 second. So again, let's talk about real quick just how cats can become infected with these. Common sources are the mother. They're passing them through to their babies, when they're kittens, maybe even in utero. So, it's kind of hard to avoid that. Your cat can pick them up by hunting prey, being in contaminated soil, and, if they're getting them on their paws, and it could be just eggs that they're ingesting, then they're ingesting them and those eggs settle into their small intestines, and that's where they hatch, and then you have a problem. Shared litter boxes, especially if you've got a multi-cat household and you have one cat with parasites, you're probably going to have all of them with parasites because they get spread around really easily. So it's a lot of work changing litter all the time, and just trying to get it under control before it gets all over, spread throughout your house. They're real common in rescues or shelter environments because you've got a lot of cats in a small space. And then raw prey exposure. Now, let's talk about indoor cats. Indoor cats are generally at lower risk, but not completely risk-free. And this is something that made me kind of go, okay, I haven't really thought about that. But it does make sense. Potential exposure routes might be you've tracked in these eggs, on your shoes. Is it common? Is it likely? Probably, probable, highly probable. Depends on where you live. Again, if you're out in farm country and you're around a lot of livestock and animals and things like that, a lot of those people take their shoes off before they come into the house, which is probably a very good practice. But if you're in the city, I wouldn't think that that's going to be very common, and likely for you to track things in on your shoes, especially if you're around a lot of concrete, If you have insects or rodents entering the home, they could be exposed that way. If they've had previous rescue experience, being in a shelter, maybe they contracted it from other cats that they were with, and then also contaminated materials. So things that come in that have these eggs or spores or cysts, they're hidden. You're not going to see them because they're super, super tiny. So those are that's basically how cats can become infected. It doesn't always mean that they will, but they're just possibilities. Okay, so let's talk about conventional veterinary recommendations. So the standard veterinary approach has been in kittens multiple routine deworming. So, and then fecal testing. So, and that's good. There's nothing wrong with doing fecal tests, and I'm a big proponent of doing a fecal test. And then adult cats, typically they recommend annual or semi-annual fecal exams and a treatment based on lifestyle symptoms and parasite findings. So they're testing, hopefully. I mean, I've even heard some vets that don't even test. They just recommend that their clients automatically deworm, once or twice a year. And that always didn't sit well with me, because I'm thinking, why? You don't even know if they have parasites, especially the indoor cats. So the common deworming medications are your pyrantel, praziquantel, and fenbendazole. Now this show is not targeted toward topics of medication and drugs. It's not my wheelhouse, but if you've had a cat that's been dewormed, you're probably going to recognize one of those three drugs, because that's what they typically pull when they're, treating that kind of situation. Different medications will target different parasites, and I have to tell you, when it comes to the amoebas and the protozoa type of internal parasites, your typical deworming medications don't work. They have to go to something really, really strong, and in many cases, it's a compounded pharmacy. This is what we had to do with Rocket many years ago when he got the Giardia. It was a liquid medication I had to give in a syringe. I think it was a syringe, but they were saying, don't get it on your hands. Put gloves on before you treat your cat with, this medication that you had to be compounded in a pharmacy. So it was a really powerful drug. I can't imagine what it did to his gut, because I didn't know better back then. But just know that depending on the type of parasite your cat has, it's not a one-size-fits-all. So you just need to know that. So if you're still struggling, if your cat has been treated for parasites and they keep coming back, or it's not resolving, then it's probably not addressing the right parasite. You need a different medication. So keep that in mind. And there was something else that I was just thinking about. I'll come back to it when I can remember what it was I was going to say. So the dewormers are not a one-size-fits-all, unfortunately. But then parasites aren't either. They're comprised of different types of little creatures, and they don't all respond the same way to things. So a balanced perspective, most conventional veterinarians are assessing risk factors, symptoms, and testing results, not just medicating randomly. So that's what I want you to take away from this topic tonight. Do your testing, check for symptoms, and don't just medicate randomly. Know what you're treating first, so that you don't waste time and you don't waste money. And cats, let's face it, if it doesn't taste good and it's a medication, they don't want it, right? So we have to be smart with how we use or approach these types of treatments. So, okay, so now what do wellness and integrative vets often recommend? So this is where I think it's cool, because the shift has gone from just, blanket overview, do everything the same way, to individualized care, because not every cat has identical exposure risks. So your indoor senior cats are going to be different from your outdoor hunters. Your foster cats or your rescue cats are going to be different from your indoor senior outdoor hunters, right? And your raw fed cats are going to be different. So we look at, or these integrative vets often look at, let's treat the cat. What is the cat's lifestyle like? Where did he come from? What does he like to do? Where is he getting exposed or potential exposure from? And then they recommend fecal testing before automatically treating, because then you can test specifically. They work on observation. They look at individualized risk assessment, rather than just automatic repeat deworming schedules. And I love this quote from Dr. Karen Becker, who is one of my heroes. She says, preventing the body from breaking is actually substantially easier than fixing it once it's broken. And I really couldn't agree more. And so that is kind of the whole essence of proactive wellness. We want to support and make the body super healthy and strong, because it's so much easier to work with that kind of situation than fixing it once it's totally out of balance and a mess. So these vets transition into proactive wellness. They talk about and address prevention, and they look at the whole body from a health perspective. They also look at the gut microbiome and digestive health. So your integrative vet may talk to you about topics like probiotics, how resilient is that digestive system, is there inflammation present, and what kind of support does the microbiome need? So from a balanced perspective, many integrative veterinarians discuss supporting the gut microbiome alongside the parasite treatment, so at the same time, rather than viewing deworming as an isolated issue. And I like that, because if you think about it, intestinal parasites can do a lot of damage to the gut. So that gut tissue, that gut lining, if they're down there chowing down all the time, they're going to start breaking down the tight junctions in the gut lining. They're going to create inflammation there. It can prevent a lot of absorption of nutrients and things like that. So I love the fact that these people are looking at doing both at the same time. Yes, we're going to address the parasites, but we've got to support the gut lining, the immune system, and the digestive system, because that's all in the same place. They're sharing the same real estate. So, okay, let's talk about raw feeders and parasite concerns, because a friend of mine was actually, she had her cat do an iridology assessment, and one of the things that the iridologist picked up on is the potential of the high probability of parasites, and it could have been just an imbalance, right? It's not like this cat is going outside; she's totally an indoor cat. So the big question is, but she does feed raw and she does feed canned food. So do raw fed cats automatically need more frequent deworming? Valid question, right? So there's an important distinction between commercially raw fed diets versus homemade or whole prey feeding. And I'm going to add something to the whole prey feeding in just a second. So we need to look at, when it comes to comparing commercial versus homemade or whole prey, look at the sourcing standards. Where are these companies and where are you sourcing these food animals? Okay. Were they tested for pathogens? Were food safety protocols in place to identify parasites? What kind of processing methods, a kill step for bacteria and things like that, were used in the preparation of this cat food for you? So pathogens, when frozen raw companies do a kill step, they're basically trying to address bacteria, Salmonella, Listeria, E. coli. Okay, that's really what most commercial food safety testing primarily targets. But pathogens may also include viruses and parasites. So sometimes maybe that kill step isn't killing all of those things. So to look at this more in a balanced perspective, we have to look at, well, let me add one more thing. Some cats who go outside, and you may know of a cat, or your cat may do this, they may go kill a bird, they may go kill mice, and they may eat what they're killing outside because it is their natural hunting instinct to do so. And some cats who are, feral cats, if they're hunting mice, they're living outdoors, maybe they're cared for by a community, caregiver of some level, but a lot of those cats, they will go kill mice and voles and rabbits and if they're lucky, maybe a squirrel, bunnies, birds, things like that. So they're eating their raw diet from the wild. And in those kind of situations, yes, those kinds of animals may be carrying parasites. So something to think about. It just, it reminds me of the cat who was eating the lizards and got the lungworms. It's just part of nature, and you don't have control over what those animals have eaten and what they're exposed to. So just keep that in mind. If your cat tends to go outdoors and do its own hunting, it might behoove you to do some parasite tests or some fecal testing to rule out the fact or the possibility that there might be some parasites present. So the takeaway on this side of it, there does not appear to be strong evidence that commercially raw-fed cats automatically require the routine deworming because they eat the raw food, versus, the prey and the wild animals and the sourcing. Again, we're going back to sourcing. So do your fecal testing, monitor for symptoms, and do an individualized risk assessment. And just, it's got to make sense, right? So we look at things like step back, do a 40,000-foot view, look at the whole picture, and use your common sense and your intuition. Is my cat, potentially exposed to parasites on a regular basis? Do like your own little risk assessment, and then talk about it with your vet. So now we're going to talk about parasite cleansing, or just how do you get rid of these things? There are, herbal parasite cleanses out there. There's detox marketing that you may see. There's wellness trends out there that you may see online, or, pet websites, or, even brands and things like that. I tend to be drawn to two products primarily, but actually there's a lot of really good products out there, and they're not just for pets. You can actually use some for people. But Worm X by Feline Essential is one of the herbal blends that is excellent. It doesn't address the Giardia and the protozoa type of parasites, but all the others, absolutely. It's excellent. So those ingredients that you might see in some of these herbal things would be something like pumpkin seeds, wormwood, black walnut, clove, even diatomaceous earth. If you see a product that has a lot of those put together in one, it's probably really good. I don't know that just giving one of those things would be sufficient unless it was done with a certain amount. And that's where you have to be really knowledgeable about, formulation and how much is enough and how long and all of that. So it's almost easier to go with a product that's already done that research for you, that's been tested and been successful in addressing parasites. The other one that I like is homeopathy. And with cats, if they don't like the taste of something, they don't want to take it, right? And it can be very stressful to give oral medications. So one of the beautiful things with homeopathy, especially if you're using pellets and you're dissolving them in water to make a remedy, there are really effective homeopathic remedies, whether they're the single pellet remedies. There's also some that have already been diluted for you, and a brand called Homeopet is one that makes one called Worm Clear. It doesn't address the Giardia and the protozoa. There's other remedies that I've actually found that do work that or do address those very well. But in terms of just simplicity and ease, homeopathy is one of my faves because sometimes the herbal stuff doesn't taste really good, so you've got to mask it really well. Which, we can do that through tuna juice and clam juice and sardine water and things like that, or putting it in some really smelly, uh, wet food, or hiding it real well. And sometimes you might have to break that dose up throughout the day over multiple meals to get all of those, to get the full dose in them for the day, just because it might be off-putting by the taste if they're super finicky in their food. We don't want to create any type of food resistance because of the taste of the product. So keep that in mind. Some of the homeopathic remedies, for those of you who love working with homeopathy, I'm going to find you the ones that I have found through research online. Give me just a second. I'm going to pull it up for you. Okay, there's one formula called Cina, C-I-N-A, 30C or even 200C might be more appropriate. Scirinum is one, and that's spelled Scirrhchinum. Nux vomica, if you're looking at things like Giardia, you're going to have to go with a 1M potency. Podophyllum is great for protozoa or cryptosporidium. So those are really good. And then let me see. I think that's what I have so far. The Homeopet Worm Clear, Worm X. There's even a remedy, it might be from Australia, called Cryptosporidium 200CK. It's either Australia or India. I've found that as well. So, the good thing is you do have options. So you may have to work with a homeopathic doctor or work with an integrative or holistic vet if you want to be experimenting or trying some of those alternatives instead of the traditional, veterinary medication. Okay. So sometimes you might see things advertised online that may not be super safe for cats, especially if sometimes dog products are not good for cats. So we don't automatically want to cross over and give a dog product to a cat unless that brand specifically says for cats as well. So be aware of that. Cats sometimes metabolize things differently. They're not small dogs. Some herbs can be more harmful for cats, and some essential oils we just don't want to do internally for cats, okay? Especially in situations like parasites. So be smart about it. Talk with your vet, talk with your integrative holistic vet, read more online. There are some products by Cellcore that I have given to my cats in the past that help. They're for humans as well. It really depends on if you can muscle test or if you can work with somebody who has the experience with addressing parasites for your cats. So talk with your vet first and foremost. Figure out the best plan of action based on the lifestyle. It's that 40,000-foot view. Is it the exposure, the potential for exposure, the lifestyle they live, the kind of diet that they eat, and that sort of thing. Okay, so should cats be routinely dewormed? If your cat is a higher risk, possibly. You might need to do more frequent testing, so maybe twice a year, do a stool test or a fecal test. And then address more of a strategic treatment of that. So again, if you're rescuing kittens, you don't really know where they've come from, or they were outdoors, might be a good idea. If you have strictly outdoor cats or cats that hunt outside, Excellent. Those would be the ones you would want to be testing on a more regular basis. Cats with chronic GI symptoms are off sometimes. I learned this from Dr. Becker as well. Those kinds of chronic GI issues that just never get resolved, and you're doing all the things, it could be parasite issues. So don't forget to ask your vet. If you're struggling with that kind of situation, just say, you know what, why don't we do a parasite? Why don't we do a fecal test? Let's just rule out parasites. If you haven't done that already, you might be really surprised at what shows up. And of course, if you have foster cats that have been exposed in shelter type of rescue situations, those might be some situations where you want to do more of that routine testing before you automatically deworm. Lower risk cats may also benefit from periodic fecal testing, but maybe not quite as often. So again, monitor their symptoms, look at their overall lifestyle, have that individualized discussion with your veterinarian rather than just constant routine treatment. Because remember, a lot of times these vets will just do an automatic dewormer, but it's hard on the guts. We've got to do the side-by-side, support the gut microbiome, gut lining, inflammation, things like that at the same time that you're doing all the parasite treatments, okay? So here's some questions that you can ask your vet. So the first question that you would ask is my cat high risk or low risk? And talk about all those factors that would lean to one or the other. And then the second question, how often should fecal testing be done based on the first question? Is your cat high risk or low risk? What parasites are common in my area? Your vet should know, because it's probably common for those animals to all have similar types of parasite exposure. Should we test before treating? I would say yes, absolutely. So you know what you're treating. Another question is, how can I support gut health after treatment or even alongside treatment? Okay. And then the last question might be, are there integrative approaches that you would recommend? And if they're not sure, this is where you can do your homework first and go in with some ideas, read some articles by vets that you respect or that you follow, and show that information to your vet and say, you know what, I was learning about this and I'm curious about trying this. And just see if you can partner with your vet to do so it aligns with your views, your how you want to address your feline family member. Because at the end of the day, they're our responsibility and the buck stops with us, right? So we want to support them the best way that we can and not just hand over all those big decisions to a vet or a doctor. We need to be involved in those decisions. Okay, so here are some frequently asked questions that you may not have thought of, but some people have. So can indoor cats still get worms? We talked about this earlier. Yes, indoor cats are generally much lower risk, but not completely risk-free. And again, it goes back to possible shoes, tracking in eggs, insects, rodents, rescue history, and other contaminated food or materials and things that might be in your environment. The second frequently asked question would be, do probiotics help after deworming? Well, many wellness-focused veterinarians believe probiotics may support digestive balance after treatment. So, would it hurt to add a probiotic if you're doing deworming? Absolutely not. You can support the microbiome. You can make sure that your cat is digesting and assimilating their food, so you might need some digestive enzymes if you haven't been using those. And then just keep an eye out for that stool. Is it normal? Is it abnormal? You know, where is it falling on that scale of healthy to not healthy? And then keep monitoring those symptoms. So probiotics can be supportive, but it's not a replacement for treatment. Probiotics are not going to kill parasites, but they can help support the microbiome. And also, on a little side note, if you are using any kind of like a raw goat's milk Raw goat's milk is loaded with healthy gut flora, healthy bacteria, and there's super multi different strains. And depending on the time of the year, what those goats are eating in the pastures, the grasses are different, so they're always getting something different. So adding some raw goat's milk into your cat's food on a daily basis is another really easy way to help support their microbiome in their gut. Okay, so another frequently asked question is, can cats carry parasites without symptoms? And the answer is yes. Many cats with parasites show little to no obvious symptoms. So they might get some mild infections here and there. They might have what they call a hidden parasite burden. And it's again, it's in the gut. And unless they are, I guess I would equate it to like a tipping point. The body can handle it for so long until it can't. And then all of a sudden you got this symptoms. So keep an eye on things like that. But this is where fecal testing would come into play. And it's better to know than to not know, or don't guess, test, as Dr. Katie Woodley would say. And then the last question that are frequently asked is, are parasite cleanses necessary? And this is really one of the biggest debates in the holistic pet wellness world. Some people prefer testing first, others use more of herbal approaches preventatively. Is that such a bad thing? No, not necessarily if it's natural and it's not harmful. But again, not all natural products are beneficial or safe for cats. So you really have to know what you're giving and why, and make sure that what you're giving is going to work on what your cat is struggling with, the type of parasite that it might have. And this is why that testing can be super important. Most integrative veterinarians still support targeted pharmaceutical treatment when parasites are confirmed. So it's up to you to decide, do you want to go with a more pharmaceutical route, or do you want to try these effective, more natural options that can produce the same results? Sometimes they take longer, okay, because they work with the body naturally versus working, harsh. Lots of chemical, let's face it, chemicals and, pharmaceutical drugs that are very destructive on the creatures they're trying to address. So, it's like 6 one way, half a dozen another. You just have to decide which route you want to go. If it's really severe, no one's going to blame you if you want to treat it quickly with a very strong medication, because if your cat has runny diarrhea and they're going all throughout the house, life is not good. So we have to take a little bit of a common sense approach as well with your lifestyle and how much you're willing to put up with, the inconvenience and the mess. So, a lot to think about, right? So I'm not here to tell you what to think. I'm telling you, you just have to think about things. So to wrap things up, the goal here really isn't fear-based medicine. It's not ignoring parasites altogether, but the goal is informed, proactive care. Parasites are a real part of feline health. A more wellness-focused conversations today help encourage more individualized care, strategic treatment, gut health support, and thoughtful prevention rather than a one-size-fits-all approach. So remember, every cat is different. Your cat is different. The best approach is one that considers its lifestyle, its health history, risk factors, and overall wellness. So you have to figure out what resonates in that arena right there in your cat situation. And remember, guys, you are your cat's best advocate. So if I could leave you with anything, like on a personal note, if your gut is screaming at you like, that doesn't feel right, I don't think I want to do that medication or whatever, can I just tell you to listen to your gut? Listen, that's your intuition talking to you. Versus if you get a really good feeling like, you know what, I feel really good about this treatment, whatever that treatment might be. Listen to your intuition, listen to your gut, follow your gut, because it's there to help protect you and guide you. So I hope that makes sense. Now, I was following an outline, so I'm going to come over here and I'm going to look at some questions, and we could take some questions. Atina, let's go to the top here. Atina says standard tapeworm and standard vet dewormer was used on her boys. Yeah, that makes a lot of sense because it's shelter based. Yeah. So, and that's pretty typical for, shelters and rescues. They just kind of do a one size fits all. Everybody, yeah. And in their defense, they don't always know the history of the cats that come in. So I get it, but they probably don't do anything on the proactive side or the supportive. Let me say that supportive gut side at the same time that they're doing all the other stuff. Um, Cara Van Rose says, yes, I have used and know homeopathy works. Thank you for the recommendations, especially for the Giardia and Protozoa. Yes. Will you post this after the live? Yes, this video is going to live on our Facebook, Instagram, and YouTube platform. So you can go back and watch this. Take notes if you need to. And I will put up that PDF. I'm going to put it into a Google Drive with the link, and I'll put the link in the show notes. That's what or the comments. We'll do both. Okay, so Anatina says, thank you for all the info. You are so very welcome. Does anybody have any other questions before we wrap up? I know it was a lot, but to me, it's succinct. It makes sense when you step back and you look at it from a 40,000-foot view. And, a lot of times when you're learning about holistic and integrative care, what's common sense isn't common to us yet because we're just getting out of, or maybe we're kind of still in that traditional, conventional veterinary space. And we're kind of, peeking over the fence going, what's all that about? And I wonder if it's for me or not. Do I feel comfortable stepping out of my comfort zone and trying something different? Not everybody does, and that's okay. But at the end of the day, you guys are amazing cat parents, and you love your cats to the moon and back. I know that because I see your interactions on our lives. I hear from you guys. I see posts. I know how much you care and how much you want to do better. And when we know better, we can do better, right? We can make better choices. So whatever kind of parasite question or your cat or consideration your cats might be going through, or maybe you're considering doing some testing because you're not sure about some stuff, this is just some things like some, food for thought. Next time the subject comes up, or next time it might be necessary, take some notes, go in to your appointment with your vet educated, first of all, and with questions ahead of time, so that number one, you're informed, and you don't have to rush out and make a decision right then and there if you don't want to. So if you want to go home and take their recommendations and read more about it, read the side effects of the drugs. Not many people do that. They just take the drug and then they don't think about it. But drugs are drugs. And so sometimes they do have negative side effects, and those just aren't talked about even in the vet's office. They might give you the medication, but how many times, if we're honest, that we look at that little insert and look at the potential side effects? So just something to think about. Kara Van Rose says, if a cat needs to fly, would you recommend anything to calm them? Not medication wise. I medicated my cats about, when was it? 1996, I think, when I flew them down to Mexico City when I was living down there. We stopped at the vet's office on the way to the airport. They gave them those medications, and they were so loopy for like 48 hours. They couldn't stand up. They were falling over, and they just looked like they were scared to death when they woke up. I will never do that again. That said, that's my decision, but there are so many wonderful things that you can do naturally. There's products like Cat Calm by Feline Essential. There's flower essences like Rescue Remedy. There's other calming products like CBD that you can use to help calm the animal that might be anxious or whatever. There's color therapy. There's zoopharmacognosy, where you can put a drop of lavender essential oil on a cotton ball and put it inside the carrier, and that lavender can be very calming. You can use things like angelica root, like dried organic herbs, and put that in a little organza bag or something like that inside the carrier. So you can do multiples. There's so many ways that we can support cats when they're flying. You don't want to be sedated with medication, but just do a little online search. There's so much available at your fingertips, guys, that we didn't have 20 years ago. So, yeah, we're fortunate to live in a time where we have more options than we really ever have. And more things are coming out all the time. So there's so many ways that we can support our cats more, naturally and holistically for situations even like flying. So she says, my vet says most airlines don't want pet to be sedated, but my cat will be very stressed. And here's something else that you can try. And if you haven't done this before, I would highly recommend it. Do an animal communication session. I have a couple gals who work for us that are amazing. And talk to your cat ahead of time before you travel. Do a session. Even if it's just a quick 20-minute, 30-minute call with the communicator. Tell the cat what is going to happen. We are going on vacation, or we are flying from here to there, and you explain it and you lay it out for them in advance, and you let them know this is what's going to happen, but you're going to be safe, you're going to be in a carrier, I'm going to be with you, I'm still going to give you your food, there might be some strangers around, you can cover that carrier with a blanket or a towel of some kind to kind of keep the external stimulus at a minimum so they don't see everything that's around them trying freak them out. Do an animal communication session ahead of time and let them know what the plan is so that they are not caught off guard. And you would be surprised how much easier that trip can go. So I never rule out, this is just one of the tools in our toolkits that probably doesn't get used enough, but it's called communication. It's a two-way conversation. They can ask questions and they can share concerns and you can answer and you can provide, the support that they're going to need. Let them know in advance that this is what's going on, but you're going to be okay. We're going to do that. We're getting ready to move. We have 6 cats between my husband and I, and it's really strange saying my husband because I've been married for 2.5 weeks. That we have 6 cats between us. We are moving to Chesapeake, Virginia, 2.5 weeks away, and we're driving 6 cats, 2 cars across the country from Texas. And so one of the things that we are going to do is talk to our animal communicator ahead of time, and we're going to lay out the groundwork and we're going to tell them what's going on so that they are not freaking out from all of the noise and the movers and the car rides. We're going to let them know what to expect. And so we're planning out that trip right now. It's all about communication, letting them know. So it makes life so much better. I can't tell you, before I moved in here at the end of December at our home and brought my 4 cats in to merge our families, we did an animal communication session. And we had her talk to all the cats and let them know that this is what's going to happen. This is why it's happening. And they were on board. They're like, we'll make it work. We're just going to respect each other's space. And we know how important this is. And he loves us and we love him and you. And so it was really, really cool to get everybody's consensus and everybody on board in advance. So I can't speak highly enough about trying that. She says, yes, my old vet was a communicator, but we moved. I can try myself. Well, you know what? If you want to work with someone, take the pressure off of you, go to shop.perfectlyholistic.com and look up services and animal communication. And I have Nina and Kate, and they are wonderful. And just it can save you so much pressure. I love it. So that's my best advice for that. But Yes, she goes, if you have recommendations for other communicators, I would reach out. Thank you. Yeah, again, shop.perfectlyholistic.com. That's Purrr, effectively holistic.com. And yeah, look up services, and it's under animal communication, and you can read their bios and see who you resonate with the best, and then order that session. And there's all different types of lengths of session, types of session. They do interactive, so you're on the phone with the person, and you're sending a picture of your cats to them, and they can communicate and have this conversation, and they're just the intermediary. It's fascinating. Yeah, she says, congratulations on your marriage. Thank you so much. Yeah, it's fun. It's been quite a journey. If you didn't hear last month's podcast, it was all about the fire horse energy and manifesting, and how this relationship all transpired. So it was really cool. Anyway, I won't keep you guys. Thank you for joining us tonight. I hope you learned something about parasites in cats, and I hope it will benefit you in the future. And if you have any questions or comments, reach out. Send us a DM on our Facebook or Instagram pages if you need to. Drop a comment here. Share the show. Like the video so we can get this in front of more people. And we will be back next month for a really interesting topic. I'm gonna save the topic because we haven't set a date yet. So I want to make sure everything's lined up before I announce it. Okay, y'all have a great rest of your night, and we'll see you soon. Take care, y'all.